Good morning, ladies and gentlemen, here physically present in this room, in this wonderful city of Bengaluru, but also, from what I understand, the thousands of people who are following this conference using modern communication technology. My pleasure to be back here at this conference, which I've been following for several years, and I thank the organizers, to make a presentation about eHealth in Europe. At this first session, I think it is important to first have a look at the global issue, at the broad picture, and later on through the conference we'll focus down, we'll zoom in on your daily activities and the daily aspects of eHealth. But it's important to put it in respect to the world. Well, Europe is the smallest continent, as you may know, and with, 700 million, which is only, 3/4 of the population of India, but with 50 countries and almost as many languages. If you see these maps, look at the other one with the regions. If there are 50 countries, there are 500 regions, which are all playing an important role, trying to do it adapted to their own situation. In Brussels, the headquarters of the European Union, in fact, exactly this week, there's a big meeting on the regions. So you see how diversified that is. Cultures, languages, etc. And we are facing, as major issues, a growing demand on medical specialists due to the increasing and aging population. But that's not only in Europe, by the way. The movement of people, and more recently, including the immigration, and then the speed of the distribution of pathogens as well. We are also facing the rising of the health costs. 70% of the healthcare costs are spent on chronic diseases, and about 100 million citizens above the age of 15 have a chronic disease. And the forecast is that the cost of health and social care will rise substantially to about 9% of the GDP, the European GDP, by 2050, which is enormous. But again, this is not only in Europe, but Europe is no different. And so the solution is really in the eHealth, and whatever you call it, or whatever part it is, whether it's the mHealth, the telemedicine, the telehealth, it has to serve one major purpose, and that is to reach to universal health coverage, which you cannot just by the traditional means. Using the modern communication tools are playing a very important role in this. The situation in Europe about the rules and regulations, the challenges are to address the health issues, to answer the needs and expectations, yet respecting the local legislations, traditions, cultures, and economic differences. And all that is in order to increase healthcare quality across and safety by making eHealth part of health policy and by coordinating the EU countries' political, financial, and technical strategies. It also to improve the citizens' health by making life-saving information available between countries using the eHealth tools, and ensure sustainability of all the health systems. What has the EU been achieving in terms of policy and supporting actions? eHealth Action Plan already goes back to 2004. And presently there is another plan which started back in 2010, which is a 10-year plan supposed to end by 2020. The goal is to move the EU towards a European eHealth area. So it's broad scale. And the specific objective would be to create an electronic health record architecture, to set up health information networks between points of care, to coordinate the reactions to health threats, to ensure online health services, such as information on healthy living and illness prevention. Prevention is a very important element. Let's not forget that only 20% of the world population is sick. 80% is healthy, ready to become sick or aging. The eHealth in the EU's legal context. There's a wide range of legal issues that are relevant to eHealth already, ranging across contract law, employment and market laws, and even criminal laws. But three areas of legislation are essential: the data protection and the confidentiality and security, the product and services liability, and the trade and competition laws. You know that Europe is very fond of organizing fair competition. And what has been implemented? Well, it has been through research and development. There are all sorts of programs for quite a lot of money that are running to develop the research and development in this field. Political or policy instruments, the support of deployment, and the work with national health systems. There are lots of directives and laws which have already been set into a legal frame, and here's the list. I'll let you read that at your ease. I'm not going to bother you by naming it all. And a good example also, there are some standards that have come up out of projects. In one here is the European Code of Practice for telehealth services. It is important to have such documents to which the players can relate. And here are a few examples. The point I want to make here is Europe is actually a leader in eHealth legislation. And you see the dominance in various points. The amount of countries with established privacy legislation, established legislation to protect privacy of digitized health-related data, and furthermore. So Europe is certainly an example and should be looked upon as such, which doesn't mean that it is the solution. It just means that you count with it. And then you find here some links where you can find more details about existing regulations and laws already. So in summary, Europe, and especially the EU, has done a lot towards wide development and implementation on eHealth. It may serve as an example, as I said, of how eHealth regulation are built respecting the interests of different countries and implementation on international level. Yet Europe doesn't have a monopoly on this, and it is always ready to coordinate actions, share expertise, exchange knowledge, and learn from the rest of the world, because health is truly global. And the challenge for most countries is how to expand the health services to meet growing needs with limited resources. That is to achieve universal health coverage. The whole world, including Europe, faces situations. You know, where's the money? But believe me, there are so many things that can be done with little money, and that is most encouraging. Sometimes we throw too much money at things, believing that the money will solve things. It's not true. That's what I believe sincerely. And with all the amount of diseases around the world, which are all spreading worldwide and quickly, there's no single national healthcare system that is able to dedicate human and technical resources to deal with all. So international cooperation is a key to all that. And to end my presentation, I'd like to say a few words about the International Society for Telemedicine and eHealth, which is a society that brings together national associations and offers a networking platform so that we can learn from each other. We are using for that, well, the website, of course. We have quarterly newsletters, which are spread to more than 20,000 people around the world, and several among you may already receive them. We announce regularly information. We will share information with our members through member announcements. And we also created a year or two ago the Journal of the ISfTeH, which is an academic journal with long papers, peer-reviewed, indexed, and which is open access. So you go to the website and find that, and if you have communications to make and you wish to send in papers, please feel free. And it is also free. And then 2 national events that we have. Actually, in 2 weeks from now, we'll be in Rio for our 20th international conference. And then the traditional Meditel, which is going to be already the 14th times next year in Luxembourg, which brings basically 500 people from more than 50 countries together in a program with about 200 presentations. And then important here is the free online knowledge resources which you find on the Meditel website, which gathers more than 5,000 abstracts, PowerPoint presentations since 2002. So it's really a source of big knowledge, of grand knowledge acquired through the Meditel presentations, which you find per year, per topic, per country, and also a selection of evidence-based presentations. It is free access, and believe me, you can learn a lot through there as well. And therefore, based on that, there's no need to reinvent the wheel. There's a lot to be done, but it's also very important to share. And I'd like to end by saying, actually, there are 2 pieces of good news. First of all, there's no way back. And secondly, as we speak, the scope of all this area, all this territory, is not moving in a parallel way. It's moving like that, meaning that as we speak, there are more things happening and expanding. And that's good news, because we'll be busy for generations to come. And I repeat, there is no way back. And let's not forget one thing. It's all about the patients. It's all about the citizens, meaning ourselves. And technology is a tool. It's not a gadget, or it should not be used as a gadget. We have to learn from mistakes as well, and make sure that we use those tools, those great tools, in an appropriate way. That's also part of the knowledge and the education. Thank you very much.
That's great. Thank you.